Hi, I'm Christina Pramuji, MD of Houston Female Urology, and today I'm going to talk to you about robotic surgery for pelvic floor prolapse. First, let me tell you a little bit about pelvic floor prolapse. What that means is just relaxation of the pelvic floor. So, bladder dropping, rectum dropping, uterus dropping, top of the vagina dropping, something that's kind of herniating out the vagina, bulging out, causing pressure and discomfort. Some women will feel, they'll feel a bulge when they're bathing, or they'll start to feel it when they sit down, like they're sitting on a grapefruit. Other women, it can be organ-specific symptoms where their bladder isn't working right. They're starting to have constipation and feeling like things are getting stuck. And those can be symptoms of prolapse. There are several treatment options for prolapse, and it's very individualized from patient to patient. So I really have to examine you and see exactly where you are to determine what's going to be the best treatment for you. It could be a simple just stitching everything up, making it tighter. That's called a traditional application. It could be going vaginally and putting in a graft, which we can use biological graft. We still use mesh grafts in redo cases. Or it could be going from above to lift everything, and that's where the robotic instrumentation comes in. So it's using scopes, and I would go in through the abdominal wall in 4 little Band-Aid incisions and put my scopes in, and then my instruments. And my instruments I control using robotic technology. So the traditional scope treatments, it's almost like operating with chopsticks. You really can't control the instruments very well, and it's very difficult to maneuver. Okay, with the robotic technology, it gives 6 degrees of freedom into the instrumentation. So it almost is like I'm inside. It's like my hands are literally in there working on the patient. So it's much more precise, easier to control. For me, it's faster, and the camera zooms in, and I can really see very clearly exactly what I'm doing. And what I do is I go in and I put a graft onto the top of the vagina, sew that up, and then sew it to some ligaments right above the tailbone. And that pulls the vagina up. I think it's a great procedure because it really realigns the vagina in the right direction. I really haven't had problems with patients complaining of painful intercourse afterwards. And post-operatively, they seem to, for the most part, do really, really great. Of course, it has risks with any surgery, and we would go over that before we went into surgery. But for the most part, it's extremely well tolerated, easy to go through. Patients forget, a couple weeks later, they forget they even had surgery because they feel so good. So if you're having prolapse and you're kind of thinking about how to get that repaired, come in for a consultation. We'll check you out and see what's going to be a good option for you. You can find us on the web at houstonfemaleurology.com.